Okay. Which of the following is most appropriate management of this patient? 32-year-old man presents with painless cystic scrotal mass that he discovered during self-examination. Physical examination, the mass is found to be separate from the testes and located in the epididymal head. Okay. Okay. The mass does not cause any discomfort or interfere with daily activities. Let's see. What is this? Painless cystic scrotal mass, separate from the testes, located in the epididymis. Okay. Hmm. I mean, he's in the age to have like a seminoma. I know
Okay.
that.
Okay.
I know you don't aspirate. Um, I don't think it's like the infection of the
Okay.
like I can't say it right now. Epididymitis,
Yeah. Uh-huh.
which that would be antibiotic therapy, so I wouldn't do that. I
Okay.
do think it is cancer. I just don't know if it's immediate surgical removal because it can metastasize, usually just like the lung or brain, or if we're going for referral to oncology, or you observe it. I'm not sure. Let's see. Because it could just be something else too. It could be like if it's just separate, it could be a lipoma. I don't know. Um, my guess is surgical removal, but I don't know if you do that or you refer to oncology. Or you just observe. I'm really not sure.
Okay. What's your gut say?
I
This
know
I would
we were
say
talking.
this question is not super fair. Like I said, appropriate management for step one is not usually. It's a step two question. So I think you're in the ballpark of the diagnosis. You're in the ballpark of being correct. And so, what would you want to do here?
I don't know if we go conservative with this or not. Like I know that for some reason I think with like reproductive, you don't go conservative. I think you're more aggressive. I would stick with that answer, but I'm not sure.
Okay. So
Uh,
actually, this is gonna be this is a spermatocele, actually.
Madison. Okay. Okay.
Okay, spermatocele is a very benign thing, and a couple things you want to look at here just on a test taking strategy. He's a younger
Okay.
male that's painless and is cystic. Cystic means fluid filled. Okay, usually cancers
Okay.
are usually a little bit more solid, or they have mixed solid and fluid. Right, it has some kind of solid component, but cystic just means like fluid filled. Right,
Okay.
aka why we call a lot of things cysts. Right, because they're fluid filled and they're benign. Right.
Okay.
It's kind of located in an epididymal head. It doesn't cause any discomfort, doesn't interfere, doesn't have any issues, and it's cystic, meaning fluid filled, so it's likely benign. So if it's benign, then you're gonna just leave it alone until it's symptomatic. Okay. So he doesn't have any symptoms. So surgical removal, aspiration, antibiotics, obviously not, and then referred oncology. It's not anything malignant. It's just benign. Okay. And
Okay.
so talking to you, just to kind of go full circle here, if I were to transilluminate, taking a flashlight and look at this thing, would
Mhm.
it transilluminate or would it not transilluminate?
I think it would not transluminate.
So it would, right? Because
Isn't
it's fluid filled. So you
isn't the
should be
one
able to
that's
say it again.
okay.
You get what
I'm
I'm saying?
thinking of
Yeah.
I'm thinking like cryptocortism and patent process vaginalis. That's like little kids. Those transilluminate, right? And then cancer doesn't.
Yeah, cancer usually
That
doesn't because it's solid, right? So transilluminate just means does light go through it? That's practically what it
okay.
means. Okay. So anything that's fluid filled, that's either clear or whatnot, um it's going to definitely for sure, transilluminate. But if it's solid, right, like you have, giving you an example, right, like if you try to shine a light through my fist, right, I'm hoping that you can't see
Mhm.
light to the other side, right, because I should have muscles and
Correct.
things between that, right. But trying to think of, maybe the skin between your fingers, right, which is pretty thin,
Or a
or
blister or something, right? If you had a blister.
exactly, you should be able to see light through that, right. So
Okay.